Today we are doing an eye and ear assessment. First I'm going to use some patient identifiers. What is your name?
Jacob.
And your date of birth?
May 26, 1998.
Alright, and then I'm going to provide some privacy and perform hand hygiene. And I'm just going to do an overall inspection of the eyes. What do they look like? Are they swollen? Is one swollen or both? The appearance of the pupils, are they both round, and are they the same diameter, or is one smaller than the other? And looking at the sclera, the sclera is the white part, and it should always be pearly white. Something like jaundice could cause it to be yellow, and that can do with some liver dysfunctions. And then we want to start by looking at the cranial nerves 3, 4, and 6, and those are the oculomotor, trochlear, and abducens. And first we're going to start off, I'm going to grab my pen light, and I'm going to check for any nystagmus or involuntary shaking of the eye by moving my light in 6 different points. So if I can have you stare at the tip of my pen. And there wasn't any shaking, which is good. And then we move on to checking to see if the pupils react to light evenly. So if I can have you stare at the tip of my nose. I'm going to do one eye at a time. That one dilated, that one dilated. And they're both the same size upon dilation. And then we want to check for any accommodation. This is to see if the eyes are able to follow objects appropriately. So if I can have you stare at the tip of my pen and follow it. Crossing of the eyes is a good sign. This means that he's able to move the muscles in his eye appropriately to follow an object. And then we're moving on to the ear, so I'm going to perform a whisper test. And I'm going to ask the patient to occlude one ear, and I'm going to whisper, whether that be a number, a letter, anything, and ask him to identify that appropriately. So I can have you close your ear. All right.
Apple, banana. Soda can.
All right. And he identified both of them correctly. And then if there was any abnormalities in that, we would have to do some further testing. And then there is the Rene test, and this tests for conductive hearing loss or sensory neural loss. So I'm going to say I had a tuning fork. I would bang a tuning fork off my knee, let it vibrate, and move it to the mastoid process right behind his ear. And this is bone vibration. So once he believes he stops hearing the vibration, I'm going to move it right in front of his ear. And this is the air vibration, and he should be able to hear the air vibration even after he said it was gone on the bone, because the air is more sensitive than the bone. And I would do this on both ears. Check for any abnormalities or differences between both the ears, because sometimes one ear loses loss than the other. And we also, like upon hearing, we want to ask if the patient works around power tools or is in a loud environment. They go to concerts often. Ask them if they use ear protection at these events. Like if you're at a concert, of course you want to wear ear protection. If you work in a noisy environment, yes. A factory, yes. It's very important that we protect our ears. And then we move on to the Weber test. Again, I would have a tuning fork, bang it off my knee. Instead of putting it at the mastoid process, I put it at the top of his head. And he would let me know if he hears the vibrations equally in both ears, or if one ear is louder than the other in regards to that vibration, or if he hears a ringing in the ear. A normal response would be equal vibration sounds. If one ear was more significant than the other, more testing would need to be involved. And that is it for our ear and eye exam.